Hi, Billy. I'm really glad you came in today to talk about how you've been feeling. I know it's frustrating to suddenly feel tired, short of breath, and pale, especially after returning from a meaningful trip abroad. But I want to explain what's going on with your health in a way that's easy to understand, and more importantly, help you feel better and stay well in the future. What is happening in your body right now? Based on your symptoms and lab results, we believe you're experiencing something called acute hemolytic anemia. That means your red blood cells, which carry oxygen throughout your body, are being destroyed faster than they can be replaced. This is what's causing your fatigue, shortness of breath, and even the yellowing in your eyes, known as scleral icterus. A key reason this is happening is likely due to a condition called G6PD deficiency, which is more common in African American men and often goes undiagnosed until a trigger causes a reaction. What is the role of G6PD deficiency, a genetic condition? G6PD stands for glucose 6-phosphate dehydrogenase, which is an enzyme your red blood cells need to stay strong. Without enough of it, certain things, like medications, infections, or even some foods, can cause your red blood cells to break apart or hemolyze. G6PD deficiency is something you're born with. It's passed down genetically, most often from mothers to sons. It's a common inherited condition in people of African, Mediterranean, or Southeast Asian descent. Now, until recently, you may not have noticed symptoms. But when you took that anti-malarial medication before your flight home, it likely triggered a reaction in your red blood cells. Why did that medication cause a reaction? Certain medications, like anti-malarials, sulfa drugs, or even some over-the-counter pain relievers, can put stress on your red blood cells if you have G6PD deficiency. That stress causes the cells to burst, leading to what we call drug-induced hemolytic anemia. That's why you started to feel worse a couple days after taking the medication. It wasn't an allergy or infection. It was your red blood cells breaking down. What is the connection to diet and nutrition? G6PD deficiency doesn't just affect how your body reacts to medications. There are also certain foods and substances that can trigger a similar problem. These include fava beans, sometimes called broad beans, tonic water, which contains quinine, foods or drinks with sulfites, and mothball exposure, naphthalene. Sulfites are used as preservatives and antioxidants in foods and beverages. People with sulfite sensitivity or certain blood disorders, e.g. G6PD deficiency, may need to avoid them. Common sources: dried fruits, apricots, raisins, prunes, wine and beer, especially white wines, bottled lemon lime juice, grapes, especially processed or non-organic, canned or frozen vegetables, especially potatoes, mushrooms, pickled foods and relishes, baked goods with dough conditioners or preservatives, shrimp may be treated with sulfites to prevent black spots, condiments, vinegar, sauces, chutneys, soft drinks and fruit juices, especially in fountain dispensers. Look for labels that say sulfur dioxide, sodium sulfite, sodium bisulfite, potassium metabisulfite, etc. So it's important to pay attention to what you eat, especially when traveling or trying new foods. Good hydration, a balanced diet rich in iron-containing plant foods, since you may avoid red meat, and avoiding known triggers can help you stay well. What happens next? First, we'll stop the medication that caused this episode. Your body will begin to recover naturally over the next few days or weeks. We may need to monitor your hemoglobin and kidney function, provide fluids and rest. In more severe cases, give you a blood transfusion. But that's not always necessary. To confirm the diagnosis, we'll also do a G6PD enzyme test, although it might be best to wait a little until the current reaction settles down. How to protect yourself moving forward. Now that we suspect G6PD deficiency, you can take steps to prevent future episodes. Tell every provider, pharmacist, and dentist you see that you may have G6PD deficiency. Avoid medications on the Do Not Use list for G6PD. We'll give you a printed copy. Consider wearing a medical alert bracelet. Keep a wallet card with your diagnosis and safe medication info. We'll also review alternatives for your joint pain since you've used ibuprofen occasionally, as that may also be risky in your case. Final thoughts. Billy, I really appreciate you trusting us with your health today. I know the medical system hasn't always earned your trust, and I hear you. But being here today, especially after 15 years without a checkup, was a brave and important step. Now that we know more about how your body works, we can give you the tools to protect your health and avoid future complications. You're not alone, and we'll walk with you through every step. Thank you again, and don't hesitate to call us with any questions. And be sure to take time to review the list of references.